Hi guys, welcome to my channel. If you're new here, I am Dr. Ngm, Dr. Njoku Martins, Ngm for short, and you're very much welcome here. So guys, this is week 10 of 50 weeks of housemanship. Yeah! Hi guys. Hello. Is it your forehead you're covering or your eyes? I like your piercings. I've been looking at it for a while now. She has really cute piercings on her ear. Yeah? Where did you do them?
Yes, belly button.
Really?
Yes, I do too.
How did you know?
Huh?
How did you know?
You cannot have fun her ear, no belly button.
This is around 10:25 p.m. It's around my team is literally running around 10:25 p.m. Yeah, and we are on call actually. On call, and I'm still outside heading to A&E right now. Yeah, and yeah, I'll catch you guys later. So how did you come to the conclusion there is acute pancreatitis? So yes, I know I told you guys to guess the unit I would be ending surgery with, yeah, and well, I'm in general surgery. Oh god, I don't know how to feel about this posting, yeah. I've always looked forward to it for whatever reason. I don't know. From everything I was hearing, general surgery was very tough. Everybody, they have a lot of patients. You can have emergency surgery, and it's 3 weeks. It's 3 freaking weeks. Did you get me? So it's just like orthopedic surgery. Yeah? You get to spend 3 weeks in general surgery. So either you're in team A or team B. That's the beautiful part. So you're not always on call. You're not on call every week. Do you get? Maybe this weekend now team A is on call, next weekend team B is on call. So fortunately I am in team A, and I get to work with one of the best set of people. Yeah, their level of knowledge is over the roof. Yeah, and sometimes I feel like, let me tell you the honest truth is that sometimes I feel like, well, obviously I know nothing, do you get? But like sometimes I feel like I'm too inadequate. Do you understand? Like working with these people, getting to experience them when they are talking about their patient and line of management and all whatnot. Like it gives me this feeling of, will I ever get to this point? Do you get? It gives me that feeling, and I'm like, wow, I'm literally just amazed, and I hope to be like that soon. Yeah, I obviously now you need to read some level of experience and all of that to get you there, but then I can't wait, honestly. So general surgery, we have 4 consultants in our unit here. We have we have 2 regs, we have a medical officer, then we have 2 house officers, I and my colleague. Apparently, their timetable goes like this: Monday is consultant ward round, Tuesday is theater day, Wednesday is consultant ward round, Thursday is another ward round, Friday is chemotherapy day / ward round. So you can, after ward round, you still do your chemotherapy literally. Yeah, so I think that's for general surgery team A, and I feel like this is the less of the more stressful one, because general surgery team B, things I've been hearing about it. Sorry, but yeah, but general surgery team A, I'm just so blessed to have been in this unit literally. Yeah, actually, yeah, super blessed to be in this unit. I get to learn a lot from my chiefs basically. Yeah, and yeah, it's kind of eye-opening to the loads of things I don't know. You get? So yeah, I'm opportuned to be in this unit here. And I have a very funny reg. Now, we call him Royal Reg. Do you get? You get to know why I call him Royal Reg in another video, but just know we call him Royal Reg. Literally, he is a fountain of knowledge, basically. I know you must have seen him in most of my videos here because he keeps haunting me and looking for my trouble ever since he got to find out that I'm a YouTuber, yeah. Just beautiful to see. I admire him a lot, actually, yeah. And I hope to be like him when I grow up. So yes, my first week of general surgery, yeah, one thing blew me away, actually. That is the aspect of chemotherapy, giving chemotherapy drugs. So initially, don't think I ever came across all those chemotherapy medications and all whatnot, like see them where they are being given. Do you get? That's the honest truth. In my whole medical school year, I never actually saw it. Was just maybe once or twice during rounds I saw somebody giving medications. I was like, why are you by this side of the ward? Do you get? And what drugs are you giving? Yeah, so I was able to see one or two of the medications. Well, like this particular chemotherapy day, I was like literally shocked. Do you get? I was like, oh, these are the drugs, and they look like normal medications. Do you understand? Well, yes, they look like normal medications, except for some of them that have different colors and all whatnot. But then I'm like, so this is the small vial of thing. I think I was so shocked. Did you get that day? And I ended up enjoying myself. I was trying to cut open a bottle, which had never happened. Do you get? But yeah, I was super shocked at the drugs. I was like, so this is the small vial of drug that can cause all that side effects. Do you get? If you know about the side effects of chemotherapy medications, yeah. And I was like, wow, one needs to be really careful. Do you get? So lucky enough, it wasn't like a deep cut. It wasn't nothing. It was just maybe like while I was opening a small ampoule. Do you get? And yeah, it's healed somehow now. So yes, that was my big shocker in general surgery, yeah? And you get to give these medications. First of all, the doses and everything is being calculated, and they have like a table, a chart where the one you were giving, the one you're supposed to be giving later, like how many cycles, that kind of thing. Yeah, it's being charted. And when you come, they have a place where you get to sit. Do you get? Although it's not very conducive. I used to pity those people. Do you get? I pity those people that day, because how will you be taking this kind of medications and you're sitting on an upright chair? Do you get what I mean? Coming to see that, well, this is what they can afford, this is what they have. Sometimes you have up to 8-10 patients that are undergoing chemotherapy, and sometimes when you see them, you can really see that they are literally depreciating. Do you understand what I mean? And I don't know, that was my shocker day. Do you understand? Every other thing is like regular surgery rotation, do you get? But that was like the shocker for me, my first week of in general surgery. Which brings me to this, yeah. So within the course of my cardiothoracic surgery rotation, yeah, for most of the persons we ended up putting or doing thoracostomy for were breast CA patients, people that have metastatic breast cancer. Do you understand? And there were a lot of those patients. Trust me, there were a lot of those patients. And most of them come to the hospital when they are literally breathless, when they are like, I don't know, when they are very, very critical. Even in the accident and emergency, we get to see most of these people coming there and they're like literally out of breath. Do you understand? And when you get to read their folders, you notice that okay, they had been to the hospital once or twice before, and maybe they were told what it entailed. They were told they had breast CA. They were told they would need rounds of chemotherapy. Some of them stay for the chemotherapy, but then maybe when they are referred to for radiotherapy, we don't do radiotherapy in this session, in this center. So when they are being referred for radiotherapy, they don't usually go to the site of the radiotherapy. Like they just abscond literally, and then come back when they are literally very critical. Do you understand? So I don't know, I'm like, is it that the whole breast awareness, every breast cancer awareness and all those things that I used to hear of, like people don't take it very seriously. I remember when I was like 16 or so, and I got to find out about how to do breast examination. Do you understand? as small as I was. And around that period, I think we also have, okay, I was in an association called Altar Girls Association, do you get, in Catholic, so apparently, yeah. And like most of the things that our president then used to talk about, yeah, were like how to examine your breast and all of that. She just found out about it and she decided to teach us about it. Do you get? I don't know. I wouldn't say that the breast cancer awareness thing is not very effective. I don't know exactly know what the problem is, do you get? But I just feel like a lot more persons are not taking it very seriously. Do you get? Because if you count the number of cases we have in clinic, like the number of patients that come to see us in clinic here, in general surgery, like more than 70% of them have breast CA. Do you understand? And a lot more of them present when they are very critical. Do you get? Kudos to those people that present, notice maybe one or two small things on their breast and they decide to present to the clinic and they undergo treatment immediately. Do you get? Those are people, for me, I feel like, even I wouldn't say those are people that are knowledgeable, because even people that are knowledgeable, they don't want to take it seriously. Do you get? I would say those are people that understand the importance of health. Do you get? Because there are some people too, no matter the level of your knowledge, no matter, there's still some fetish belief and superstitious belief that will make you not want to undergo necessary treatment for breast cancer. Do you get me? So I wouldn't say the breast cancer awareness has been ineffective, because I see a lot of that. Do you get? Both on social media, both naturally, you even see them sometimes, they do rural outreaches and all of that, and they teach about breast cancer. Do you get? But I don't know where we are getting it wrong. Do you get? I honestly do not know where we are getting it wrong. But if you're on my TL, yeah, if you're here, do you get? If you're watching this video right now and you're female, I need you to take this thing seriously. Breast cancer is real. I don't know how else to put it. You know, back in the day, or earlier, people don't used to see cancer as per a Nigerian disease, sort of. So they feel like whenever cancer is called, it's like a white man's disease and all of that. But it is here and it is killing a lot of people. Do you get? It is here. Just recently, we had a patient, yeah, and because of her superstitious beliefs and all of that, she felt somebody was trying to kill her, blah 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 blah. And then when she finally came to the hospital, told her she had breast CA, and I don't know, and she didn't seem eager to want to go for treatment. Do you understand? Those kind of things too. I know we have a lot of problem in Nigeria. Do you guys? We have a lot of problem. I would say ignorance, lack of education, all those things are like the underlying problems. Do you understand? And then your difficulty to want to accept science. Do you get? The difficulty for us to accept science and to understand that these diseases are real. They are not a white man's problem. Do you get? In fact, our problems are just too much. Do you understand? I don't know what the problem is, but if you're watching this video, I need you to browse about breast examination. It can save your life, literally. Browse about breast examination. Teach people around you as much as you possibly can. You need to know, as a female, you need to know how your breast is. Do you get? That is why mirrors are very important. So after taking your bath, just stay in the mirror and notice how your breast is. Notice, okay, how the shape of your nipple. Notice sorry for all the guys that are watching this video, but then, do you get? Feel it. Google about breast examination. It is actually very important. Teach one or two people around you to help the whole breast cancer awareness thing to go as far as it possibly can. Do you get? So yes, it is important. Do you get? Naturally, or generally, some kind of diseases or sicknesses people have, something as small as appendicitis, now they will tell you we have a traditional way of treating it. We have this kind of way, and then when you go round for almost 2 years, you now come back with a very complicated case. You now come back with adhesions and all of that. And why are you doing this to yourself? Do you get me? Why? So whenever you notice these small things, these small changes in health, I know to you, or maybe in our setting and all of that, it may not, like, you may not be treated as an emergency, but it is better to present when it is not yet an emergency than to present when you're completely helpless in the hospital. Do you get? So yes, notice the changes in your health, notice the changes in your breast, particularly since we are talking about breast cancer, and present to the hospital early and on time. Do you get? That is only when you can be able to at least treat it and contain it, at least, so that it does not spread to other parts of your body and all of that. So I think I've ranted enough about breast. Whether you're a medical doctor, diseases don't look at face or don't look at what you studied in school. Do you get? We are all humans, literally, and our health should be priority. So basically, I have roughly 2 weeks left in surgery. Yeah, I don't know, counting down these 2 weeks is, I don't know what the feeling is. I just feel like I'm really going to miss surgery. Yes, thank you guys for watching. Thank you so much. All the people that keep leaving comments, thank you. I see your comments. Thank you so much. And the aim is to always, like, maybe when you watch my videos, you tend to go home with 1 or 2 things, yeah. So yes, thank you very much for engaging. If this video has brought a smile to your face in one way or the other, give it a thumbs up, yeah. And I'll catch you guys in the next one. Peace.